Kristen Moffat from Boston Children's Hospital. Dr. Moffat, thanks for being with us.
Sure, thanks for having me.
So the CDC, we understand, is getting ready to send an alert to doctors all across the country about this rare disease that's appearing in children, multisystem inflammatory syndrome, we think is linked to COVID-19. We discussed this last week, but a lot can change. So what's the latest we know about this today?
Sure. So we are getting a few more data sets. The largest data sets have come out of Europe, especially from Italy, and out of the UK, particularly of London. And then the largest case series is coming out of New York City. And what we're learning is that this is still a relatively rare condition. It seems to occur probably in the 2 to 4 weeks after infection, and its association with COVID-19 is not completely assured yet, but most of the patients who are presenting with this syndrome are testing positive for COVID-19, either by the nasal sample or by antibody testing, or they had a strong history for an exposure in the several weeks prior to getting sick.
So what should parents be on the lookout for? What are the early symptoms of this disease?
Yeah, so the symptoms would really typically start with a fever, and this would not be a one-time fever. This would be a fever that really persists and has lasted usually at least a couple of days. But it can be accompanied by symptoms, abdominal symptoms, including either abdominal pain or vomiting. If the fever is associated with a rash or redness of the eyes or redness of the mouth, anything that's concerning to families out there should certainly be reviewed with your pediatrician.
And I know you mentioned New York, 100 cases in New York. 3 children, we understand, have died of this. So why is it fatal in some children?
It's really not known yet. Of course, any fatality in children from this syndrome is devastating, but it should be noted that this is a treatable disease, treatable with various things to really calm down the immune system typically. So it will be really important to continue to collect as much data as possible about any one of these cases. And lots of people are working on research as well to understand how patients present differently and to see if maybe there isn't a genetic association.